press record, and then I am going to share my desktop. Okay. I think everyone should see this HL7 Connectathon 26 Care Coordination Track Orientation slide, right? Yep. Great. So thank you, co-chairs, for letting us use this time to highlight the work that we're going to do during the Connectathon. For today, we're going to have like a quick welcome and get a sense of the people that are on the call. We did send invites to our larger MCC stakeholder as well as a couple of different listservs on the HL7 in the HL7 world. So we just want to know who's here. And then we'll recap what we've done in the care coordination track in the past, what's coming in January, and then there's just some like tips to prepare all participants for the virtual Connectathon in January. So we'll share that in some next steps. So I'm gonna go to the next slide. This is our track leads, and to start our kind of roll call, I'll have the track leads introduce themselves, and then I'll see if I can pull the participants that I see on here and just like you say a quick hello, and if you're attending because you're interested in participating or hearing more about the care coordination track. So Evelyn, I'll let you go first and we can go down the line.
Sure, thank you, Katya. Good afternoon, everyone. I'm Evelyn Glago. I serve as the HL7 or SDO liaison for the Multiple Chronic Conditions project. I also wear many hats with other HL7 projects. I think many of us do. But yeah, happy to be here to talk to you about this track and go through a few of the slides. Dave?
All right, thanks, Evelyn. It's Dave Carlson. I think I have met most everyone on the list here. As we'll be describing a bit during this introduction, that I think many of you know, we've had a care planning, care coordination track at the Connectathon since January 2017. We kind of diverged a bit into care management and care coordination. We're recombining with the focus, a renewed focus on the integration. So welcome today. Thanks, Evelyn. Katya.
And you heard from me earlier, I'm Katya Shell. I am also helping with coordinating this track, and I've been working on the MCC project. You guys, if you're joining this call on Wednesdays bi-weekly, you've probably heard my voice more than not. So happy to speak with you all again. Joe? Sure,
so this is Joe Bormel. I'm a board-certified internist with training in rheumatology, public health, and informatics. I've been working on the project since the kickoff, and we've been working through the chronic kidney disease, and as the first four, followed by the next several chronic diseases, including coronary vascular disease, type 2 diabetes, and some other content. So with that, I'll pass things off to Lorraine. Although I don't see Lorraine on the list here.
Okay.
Yeah, I haven't seen Lorraine.
So I'll pass it off to Jerry, who
do you see him on the list?
I don't see him on the list either.
Okay, well,
so back to you, Evelyn.
So I'll just, at this point, kind of go down our participant list. Stephen, we heard from earlier. You want to say a quick hello?
Hi. Yeah, so if you want to go down the participant list, that's fine. Yep.
Okay.
Let's go ahead.
And then LK, HL. Who's that?
Oh, hi, this is Laura. Sorry, I didn't know my name wasn't on there.
Hi, Laura. Okay.
I didn't even notice that it wasn't showing my name. Sorry.
No,
so
it
yeah,
is showing
Laura
your name,
Hierman.
but different.
Okay.
Yeah.
Differently.
Thanks, Laura. Katya, I'm just thinking in the interest of time, because I know we've got several folks, maybe if there's folks that are joining us for the first time.
Yeah. How about that?
Anyone new to these calls or haven't joined before?
Good afternoon, everyone. My name is Jibril Kamara. I'm new to this is my first time attending this call. I'm a fellow recently assigned to MCC eCare Plan. So this is my first time attending the call. I'm happy to learn more about this project. Thank you.
Hi, and this is Kay Gista. I'm VP of CKD and Transplant Care Management at Satellite Healthcare over in San Jose, California. And we are building out our own care management program. So I'm delighted to be here and learn about what's been developed to date and what's going to be developing moving forward. Thank you.
This is Jeremy Davis. I work with Dr. Russell Leftwich at InterSystems Corporation based in the Cambridge, Massachusetts area, and working on our product team in our care management space.
This is Daryl Welk. I'm with Green Room Technologies, and I've participated a little bit off and on with the care plan group, and then recently with Dave Carlson on the clinical guidelines.
Great, welcome.
Anyone else? Okay, thank you so much for those introductions. All right, I'm going to go to the next slide. So, oh yeah, so we're going to recap. Evelyn, turn it over to you.
Great. So for those that are just joining us for the first time or have been more involved in the care management track, wanted to just orient you to the background, overall the care coordination track, because it has emerged from the previous work that Dave Carlson led. So as a formal care, the care planning and management track, as noted here, started with work that Dave spearheaded since in the past 3 years. And then in May of this past year, with support from the Agency for Healthcare Research and Quality, ARC, the Office of the National Coordinator, ONC, and NIDIC, NIH, we established what we now, as a formal care coordination track, we wanted to change the title of it to reflect, truly what we mean by care coordination. And so in May, we brought up, the goal was really to, just as the title says, to coordinate across all the FHIR-based initiatives that were focused on exchanging data to support care coordination activities between healthcare as well as social service areas. And so we looked at opportunities to, align across these 5 projects you see here. So PASSIO being another track, led by the MITRE team, focused on creating functional and cognitive status assessments. So they have 2 implementation guides. They're balloting as well now. We have the electronic long-term services and supports FHIR-IG that is STU, but is moving through maturity and incorporates the care plan resource. Then we have the Gravity project that has been focused on developing the standards to support the exchange of social determinants of health data. We have the bidirectional services e-referral. This is CDC project, public health focus, but they also have a FHIR-IG to support closed loop referrals. And then last, the new project that was kicked off, and we'll give you some information on them in October of 2019, which is the MCC, multiple chronic conditions, e-care plan work. So what happened in May was really about connecting the dots and purposely being able, some of these projects like PASSIO, ELTSS, Gravity, were all testing, had their own tracks. ELTSS was combined with PASSIO. And so we really wanted to be able to show how all these FHIR-IGs can work together. In September, though, we shifted gears. We had 2 separate tracks, one for care coordination and one for care management. The care coordination, and we'll speak to it more, was very much focused on moving forward with the MCC work. And then Dave's work with care management was focused on the testing the computable clinical practice guidelines, and he'll speak to more of that. So now we're excited to be able to integrate both of them, and that's what we're here, why we're here today. Next slide. This is just a snapshot again of how we brought those different tracks together in May of this year. We identified 9 scenarios to test, which really, again, encompass the transactions that were already in those fire IGs that we were looking at, and the link there is at the bottom. But as noted here, you had the gravity track that on its own was testing the ability to complete a social risk screening and then refer them out for services. And then the PASIO was really supporting the exchange of data for transitions of care. We also had on the PASIO track the ability for all this data to be made available to a person-facing app or portal, and that was all tested. Next slide. In September, we narrowed it down, as I mentioned, for the MCC eCare plan work, because we wanted to be able to further the testing of the Smart on Fire app. So for those not familiar, what the eCare plan project work, these are, the scope of it is really has been around identifying the use cases to support the documentation and exchange of MCC eCare plan data within EHRs and other health IT systems. It's focused on developing and prioritizing data elements, clinical information models, and fire mappings. Again, when we talk about multiple chronic conditions, they're focused on chronic kidney disease, diabetes, hypertension, and pain. Part of this is developing and testing an open source clinician facing Smart on Fire app. And now we just recently shifted to be include person facing or patient facing one. And then lastly, of course, moving forward with the development and testing and balloting of a Fire IG. And the Fire IG will not be balloted for another 2 years. So we are not, unlike other tracks where they must be testing to support a ballot, the MCC, we still have time. So it's good on our end. Next slide. Here's our Patricia. So as part of that September Connectathon, we had used a different persona for the May Connectathon because we weren't ready. We hadn't developed our Fire IG for the MCC eCare plan project or the Smart on Fire app. So we had other personas. So then we solidified who our persona would be for the MCC work. So please meet Patricia Noel. We identified her as a 65-year-old woman. Again, then you see all her health concerns are related to the chronic conditions of interest for us. Social risk, because we do want to embed social risk and social needs. So I aligned it to what data sets were available within the Gravity project. So the Gravity project is focused on defining the data definitions and the codes to support multiple SDOH domains. And food insecurity was complete in 2019, and they just wrapped up housing and transportation. So we incorporated 2 of them there, and then, she has 1 child located in Illinois. And so, in the interest of time, this is just a snapshot of all her, how she feels, the fact that she's dependent on her daughter. She has too many conditions to manage, and, she needs more help. Next slide. So this, again, these components, so as we look through these personas, they're organized very much building on a best practice from the chronic kidney disease work where they had identified other personas, and they've been really helpful from a user-centered design perspective of really getting a sense of developing standards that align to the users, right? And what are their needs and their wants and preferences. So again, you see this here that again, really, all these things are why we've focused on the transactions we have. So again, we'll make this available to you, but you can go through her story and get a better sense of why we're testing the scenarios that we are. Next slide. So our goals in September, based on this user story, were very simple. We just wanted to generate and update a care plan in a clinical setting. And then we wanted to expose it. So simple, but at least, we wanted to be able to get that right to inform our Fire IG. We also had the stretch track goal that now we're able to do more, but we really wanted to start better coordination with the CPG work that Dave was leading. And we're happy we're able to do it for the January track. Next slide. This is, again, all these tracks, scenarios are on the Connectathon page for September. We did 9 scenarios. In the interest of time, I won't go through all of them, but it's really, again, based on the story, based on her conditions, having the different systems support, the development or the query and the lookup of a specific document or condition or change. So these are all focused on that, and listed on the track page. Next slide. So what we learned in September, which is really important, I guess, why we have these Connectathons is to learn from previous Connectathons, improve the standard, address things that have been raised as a challenge or, something to continue testing. So again, these are achievements. We were successful in testing all 9 scenarios, and this just outlines everything that was retrieved and assessed. Lessons learned. So important for everyone planning for January are these. So we have not had a chance to spend more time here, but this is really where we want to continue the discussion with all of you. So I'll pause here and just go through these. Just keep this in mind as we plan out our testing in the coming weeks and what we'll achieve on January 14th and 15th when we start testing. So first one was valuable to have valid sample files and examples in the implementation guide. Consider expectations for rendering the plan, both for providers and for patients. Should not be too different. Consider coordination management among multiple servers. Really important, especially for fire and having different endpoints. Challenge of adopting a new care plan implementation guide for vendors that have already adopted the care plan resource or other related implementation guides. So this is important from an adoption and implementation perspective, that if we are moving out with a very complex MCC eCare Plan Fire IG and supporting Smart on Fire apps, is to acknowledge what's already been implemented in the field and figure out, of course, we want to make it better, easier, more useful, but not to change things so significantly that it will end up breaking what's already live or be more cumbersome. We also want to consider using care plan custodian as the designated responsible party versus the care plan author definition. Want to identify or consider identifying a system role actor that monitors orders and results and links them back to the outcome reference. Really important for care planning as a process. And then last, consider where the activity outcome and goal should reside in the Fire IG. So something that has been brought up, and I know there's ongoing discussion on goals, but this was an opportunity where our feedback received was about considering a goal hierarchy. Next slide, and we're moving along just because we have so much to cover. So what are our plans for January? So our plan is overall, here's our track description that's on the Connectathon page. We're doing it jointly, the eCare Plan project with the Logical Care Management project. The goal is to continue testing the eCare Plan Fire IG and Smart on Fire apps and continue testing the work under the Logical Healthcare Management project with the CPGs. And of course, this work builds on past over 3 years of care plan testing. Next slide. Our goals are here again from our Connectathon track page. We want to create and update the MCC eCare Plan in a provider-facing Smart on Fire app. We then want to expose the eCare Plan to the newly developed, so this is new. We didn't have a patient-facing one in September. We will have one for January, Smart on Fire app. Then we Dave's focus is evaluating testing the methodology, and he'll spend to transform BPM plus decision models to fire clinical reasoning artifacts. He'll spend more time going through that. And then lastly, we want to create or update patient-specific care plans to coordinate between primary care and other providers and patients. With that, I am going to hand over, is this now Dave, right? Spend more time on the care management side. Dave.
All right, thanks, Evelyn. There's a lot more details that could be put on here for the care management. And so note at the bottom of this page, there's a link to a wiki, a Confluence space on Logica. We'll be continuing to add content and details there for supporting materials for this Connectathon track. And actually, that's where we provide a lot of background on the standards being used here. So the key focus here is to provide a computable representation of clinical practice guidelines. And in particular, leveraging a combination of standards from the Object Management Group, or OMG, and HL7. We're working with Logica to host this project. It's not working directly toward a specific implementation guide validated artifact at this point, in large part because it's intentionally, for the beginning, working toward integrating standards from two SDOs that have a significant overlap in synergies. And so that's really the objective of this project, is to identify those synergies and how they can provide both a tool chain and a methodology for providing platform independent, clinically focused models of the decisions within the clinical guidelines, and then to transform those into executable artifacts. And the work we're doing here is to transform those models into the HL7 standards for the clinical quality language, plan definition, and then to be able to execute those artifacts to produce recommendations that will be contributed into a patient care plan. So that's where we're bringing back together this sort of long-standing parallel work on the goal, the desire to have computable representation of the guidelines, but then bring this back to the context that Evelyn described, in particular for patients with multiple chronic conditions that are served by multiple practice guidelines, and the extent we can make those computable to contribute recommendations and content. So next slide, please. So there's a lot more detail on specific artifacts, which will to support those of you who are interested in this area at the Connectathon, and we'll be posting more of those details, sample artifacts, and so on, either to the Connectathon page or to our Confluence page. But I will have here just to introduce this area to you, that we're grounding the majority of this work on a implementation guide that's well underway. In fact, it's published. It's been through a balloted round at HL7. It's called the HL7 Fire Clinical Guidelines, IG. And within that, there's a very extensive description of an approach and a knowledge architecture, which in fact is part of the Fire IG, but it's described in a way that's really grounded on the clinical principles around care and the use of guidelines. And so these definitions come directly from this HL7 Clinical Guidelines IG. And what I want to emphasize here is the relationship between the CPG, or Clinical Practice Guideline, knowledge artifacts, and how those contribute to and relate to the care plan, or what's shown here in the center. This is the case. And these are really the clinical records for a patient. And I'll describe in a moment here, describe it as the derived case features. And I'll get more into that in just a second, and how that's really a core part of what we're testing at this Connectathon. Next slide, please. So this also is a diagram from the FHIR Clinical Guidelines IG that puts all that in a bit larger context. And most of these diagrams and a lot of most of the text is the work of Dr. Matt Burton. Those of you know Matt. He worked at Mayo for many years developing a lot of these concepts. He's now at Upper Vita, but also very actively participating in the COVID-19 Healthcare Coalition, and we're drawing our specific example for the Connectathon from a COVID-19 implementation guide underway. And I just refer you to the site for a detailed description of all of these elements, but I want to emphasize here, so it started at the bottom and was green for the case summary. And the way Matt laid this out, and we've really looking toward describing with the logic and how we execute this logic from the guideline, is we call the case features or the events, the solid green dots, are the records from the patient's clinical record. So the conditions, the med list, labs, lab results, vital signs, and so on. But what they've done in this part of the Mayo architecture that they describe as data enrichment, and the idea there's a lot of cases where you start with the data from the clinical record and you provide inferred or computed derived values from that. A simple example is BMI. BMI may not be directly represented in the record, but it's easily computed from height and weight. Much more complex examples in the CKD, for example, includes a evidence-based formula for computing the risk of kidney failure. There's also widely used risk scores for cardiovascular risk, which then inform decisions about medications or the risk for heart disease, other cardiovascular diseases. So in this case, we're looking at a COVID-19 example where it's a risk score based upon the patient's data. That risk score is computed and then used as a basis for recommendations. So the bottom is really all of the clinical data, the derivations. We'll be focusing a lot of attention on that, using the CQL language to represent guideline rules from the clinical practice guideline, and then use those from the top section here for pathways, recommendations, recommendation rules that produce a recommendation. For example, in this guideline we're working with is the disposition or the transitions of care for a patient, either for admission into inpatient admission for COVID, or for transition into ICU, or for discharge home. Those are all parts of the guideline that we're evaluating here. So next slide, please. And this is really an extract from that, just to show the relationship kind of I've just described in words, where this for highlight one recommendation that produces a proposal which is added to the patient's care plan. That proposal transitions through a series of states as described by the FHIR workflow standards. So from a proposal to a formal request or order in that state, and finally producing events. So for example, a medication order or a lab panel order would ultimately produce events in terms of the results of those labs, and similar for procedure requests, producing procedures as the events. And all of those are related to or informed by the patient's data in the case summary. Next slide. I know I'm going through a lot of content here, but provide you sort of a background on the relationship between the guidelines and how they can inform or informed by the care plan. So this is the specific guideline that we are developing content for in the large community. We have active calls every Thursday, averaging about 15 people or so. So we are deep into actually building out these models, working with Davide Satara at Mayo, and tooling that they are producing as an open source tooling to transform the OMG models for the decision models and the case and process models, and transform those into CQL and FHIR plan definitions, and exactly to execute this guideline. This guideline has been produced in collaboration with the American College of Emergency Physicians, or ACEP, and we are deep into analyzing this guideline, working through its representation and to test that. So that'll be the core of our focus for testing during this Connectathon. Next slide is my last one for this topic. This is a few weeks old, but this is an example of the illustration of this work. So the table shown here is in fact using the OMG DMN, or Decision Modeling and Notation Standard. So it's a visual way that they found very effective to review the rules from the guideline with clinicians. It's called a decision table in that standard. But the tooling that's now open source, developed by Mayo, and really looking toward making a community tooling stack we'll be testing the Connectathon, is to transform this into FHIR-based resources, plan definitions, and a snippet of CQL showing in the left. and say this is all under very active development right now, and finding a sweet spot within this that we will be using as our focus during the Connectathon. And then to tie back to the care plan, an example of a disposition or either a lab order, a transition of a patient to inpatient care is something we'd like to test to be addition into this patient's care plan. Just a final note that we hadn't specifically looked at this patient of Patricia that Evelyn described, but I think it fits very well. We don't want to subvert her story per se, but it fits really well as Patricia has existing conditions. She's over 65, she has diabetes, CKD, and congestive heart failure. All four of those are specifically highlighted by the CDC as factors that increase a person's risk for complications from COVID. So in fact, Patricia is an excellent example to use as a story for Patricia having contracted COVID and now being evaluated and according to this very guideline. Next slide. I think that's it for when I have the introduction. So fast pace, a lot of content underway, but welcome all of your participation.
Yeah, so this is now Joe Bormel's voice, and this is the MCC team is going to be focused on testing the first two of the use cases that are listed there, and we've listed out 3 through 7 to give you kind of a preview of some of the other exciting things we're thinking that we're planning on doing. Next slide, please. So these are the 9 scenarios that we showed for the provider-facing cases in the September Connectathon. And during this, the January Connectathon, we are going to be looking at the same scenarios for both the provider view and for the patient-facing view, and focusing on, of course, the data access and the data access issues around that. Next slide, please. And then again, this is just elaborating both kind of where we've been and where we're going. And the Smart on Fire piece is new, and then the issue of accessing an HIE or a hub or a pain specialist for queries and retrieves with a need care plan would be you know, a goal or a stretch goal, depending on how we're doing with partners. Next slide, please. Yeah, so you can read that faster than I can go through it, but it kind of gives you a sense of what we've been describing, the key actors, and where the sign up is. We're very interested in anyone on this call that's interested in playing one of these system actor roles or other roles. Next slide, please. And here's where the you can find the current implementation guide and the structured definition for the U.S. Core Care Team and CQF recommendations, etc. So let me, I think that's my last slide. So next slide, please.
Yes, and then you'll be hearing from me from this point on. So just a couple of things to note. We do have a question slide at the end of this for everyone on the call to ask questions, but we just wanted to make you aware of the pre-Connectathon events. HL7 has a list of events that they're having between last week and up to the Connectathon. So the first 2 are italicized because they already passed. However, HL7 has been doing a really good job of posting slides and recordings to the HL7 Connectathon 26 page. So if you missed the track overview sessions, which were yesterday for the participants and December 1st for the track leads, you can go on their Confluence page. I have the link here, and take a look at those. It's really helpful to get a sense to have you prepare for a Connectathon and testing, especially if it's your first time at a Connectathon. The next upcoming events, I would say, are between the week of December 9th and December 18th. And every track is supposed to have a track orientation session between those times. So this is the care coordination track orientation session. So a great way to figure out when those sessions are is if you follow the link on this page, which is also the Connectathon 26 page, HL7 page. If you scroll down, there's a list of all the different tracks, and each track is supposed to post the date and time they're having their orientation session, as well as the recording after the session. Another thing to note is there will be a Connectathon prep session on December 15th. And then January 5th, they are having 2 sessions, one for track leads on the 5th and another on January 12th for participants to get everyone acclimated to using Whova. Whova is probably a new platform to a lot of people. If you attended the September Connectathon, you probably had your first experience with it. So HL7 just wants to make sure everyone knows how to use it and it doesn't impede you learning and experiencing Connectathon the way you want to. So I have a couple of tips later on how to work with Whova, but be sure to attend those sessions if you are new to Whova. So for the actual Connectathon, that's going to start Wednesday, January 13th, 4 p.m. is the kickoff. On Thursdays, when we'll start testing for all the tracks, MCC will have their kickoff in the morning of January 14th. And then on January 15th, between 9 and 4, there will be testing again, but also there are usually highlight sessions. And that's when each track wraps up and discuss what they tested. So be sure to check out the schedule on Whova for that. And then HL7 is also having their own wrap-up session and a virtual happy hour. So Zulip is another, I guess, app that some may have to acclimate themselves to if they've never used it, but HL7 uses HL7 Fire Chat, and we have a stream on there, and we will be actively using that to post information prior and during the Connectathon. And that's another great way to like link up with other system actors or vendors. So take the time to familiarize yourself with Zulip. Here's our stream link. And like I said, I have some tips for Whova. If you, well, hopefully everyone is registered for Connectathon. If you're not, register. There's a link in this slide deck at the end. And once you register, you'll get an email from HL7 for your Whova access. Please use the same email you registered to Connectathon to access Whova, or else it won't work. And I've heard, and you, if you've listened to any of these sessions, have probably heard Sandy say this a lot, that Whova prefers Google Chrome. It doesn't really work well on Safari or Firefox, sorry. And if you are still even having problems on Google Chrome, they also suggest trying your mobile app instead of your desktop. I personally used my desktop and it was fine, but that's just a general tip for everyone on the call. Okay, so next steps. This is our care coordination track kickoff. Next week or the week after, we'd like to talk more about what we're testing at Connectathon. I just want to pause and ask the co-chairs on the call. I know MCC usually joins on the 23rd. We were wondering if we could actually come back next week to talk a little bit more about Connectathon. I know Gravity might have been doing talking about goals, and I've heard from a Gravity lead that they're willing to let us join if there's no other problems with us joining on the 16th. So I just wanted to ask.
I think the week after the technical connectathon, we have scheduled it for the Clinician on Fire event.
I'm talking about December 16th. So next week.
Oh, okay, right.
Yeah, next week.
Well, Laura, we have scheduled next week for the Care Plan Dem 2.0. Our recurrent topic at the moment is talking about goal in relationship to assessment and also evaluation and outcome. I'm okay for us to flip or change the meeting agenda, but want to run it past you. Are you okay with that? Laura, are you on mute? Oh, yes, she is.
Yeah, she might be. And I can follow up via email. Evelyn mentioned that Gravity was talking about goals, but I just wanted to see that she said that Gravity would be willing to forgo. So I just wanted to double check.
Sure. Laura has unmuted herself, so we'll wait for her to respond. Laura?
Okay, I'm back, but what was the question? I'm sorry.
The question is next Wednesday, the call is scheduled for talking about Care Plan Dem 2.0 with a focus on Go. Katia has just asked the question of whether or not we can sort of shift the focus a bit to allow this group to come back and talk more about the Connectathon.
I am totally open to that. I think the only thing we need to know is I'm not clear on deadlines we may have regarding goals.
The deadline is more
can
of
the goal
brevity.
discussion help?
Yeah, I think. Sorry, go ahead.
Evelyn, with her Gravity hat on, will say no, goals are not a priority for the Gravity Connectathon in January, so we can push off the discussion for after the Connectathon.
Okay, that's totally fine. I know that, we just all care a lot about goals. I don't want to put that in any detriment.
Yes.
And so as long as we're meeting all of our deadlines to support these projects, then that sounds completely fine to do that.
Yeah, and also on that topic about Go, I have actually created a conference page, but I haven't sent out a link to publicize it yet. So there are contents in there, but probably by end of this weekend, I should be able to send out the link and then get people to visit it and contribute more content to it. But it's pretty much done in a sense.
Okay, great. And I want to allow time.
Okay, I'm going to update. So that means next week, the 16th, is we're going to talk about the Care Coordination Connectathon. Is that correct?
Right.
Correct. Yep. And then you won't hear from us again till January 6th.
Yeah, I think the week after, isn't it the week after we have a break or what? No. Anyway,
well, we need to, yes, because right now we still have things on the 23rd and the 30th, and I think we need to take both of those off. So I'm going to take those off for the holidays.
Okay.
Right. Okay.
And so, yes, we'll come back then on the 6th with the MCC stuff. And so on the 13th, which is Connectathon, right?
Right.
Right.
You're helping me present the slide.
So I just had put the goal stuff on the 13th, but I think we're going to have to throw that out. Holy mackerel, because on the 13th Connectathon, the 20th is a Clinician on Fire event, and the 25th-ish, 25 through 29 is the working group meeting. And so we're going to have to put the goals out probably into February.
Right, yes.
At the working group meeting, maybe not discuss it now, but something around goals, because I feel we're going to have feedback also based on our lessons learned on goals for this Connectathon as well. So we should maybe put it as part of the care plan session at the working group meeting.
Sure.
Thank you.
So the week after next is the 23rd. So are we canceling sort of like the 23rd call, Laura?
I think so, because I'm having so many other people cancel out even starting the 22nd. And
Okay.
so, I mean, does this group want, I mean, this group, meaning our core group that actually meets a lot every week, and being that the 23rd is scheduled to be an MCC call, do you guys want the 23rd? They just told me they were coming back on the 6th.
Yeah, we would let go of the 23rd. We thought that we were seeing the trend that a lot of meetings were being canceled, so we thought that might happen to the 23rd one, which is why we were asking for the 16th, if that makes sense.
Sure. It's entirely, I mean, if you guys think you're going to get people here in a quorum and you want to use the 23rd, I just don't know that we'll have enough people calling in.
We didn't think so either.
Okay. All right. We're making the call. We all have worked really hard this entire year. We're going to take off the 23rd and the 30th for the holidays.
Right. Okay.
And,
fair enough.
You know, raise a cup of nog to each other. And then we will all come back on the 6th. And currently it's the MCC.
Yeah.
And then the 13th, we're going to be into the Connectathon. And we may actually still hold a care plan dam call, but we have other topics. We'll figure that out a little bit later. The 20th, there will not be this call because we have a Clinician on Fire event, and most of us will be at that using this call-in number.
Mm-hmm.
And then we're into the working group meeting.
Yes.
Right.
So that's that.
Yeah. And thank you
Okay.
so much, co-chairs, for that. And just one final thing is next steps for those interested in Connectathon. Don't forget to register. Please visit the virtual HL7 Connectathon page, and we are looking for participants, and Joe touched on it, and so that's going to be the PMEHR. If you're a provider app, if you're a patient-facing app, if you're a clinical guideline practice or clinical guideline implementer and designer, we are wanting you to participate, and there's the sign-up sheet here on that page, as well as the next steps page. And then don't forget to review our care coordination track page. We are keeping that updated with all the relevant information, and we'll also have this slide deck. So at this time, I know there's like 6 minutes, but if there's any questions, anyone want me to go back to a slide, and we're happy to answer your questions on the call.
So Katia, the slide deck that you've just mentioned, has it already been uploaded to the page, or will be uploaded?
It will be uploaded, and I'll put it on our MCC like notes page, where we usually take notes for these calls, as well as our care coordination track page. So there'll be reference to each of them. So
okay, cool. Thank you.
You're very welcome. Any other questions? Okay, I think I don't hear any.
Okay, I guess this is it. So if no further question, we can give all of us 5 minutes back for your day. Not much, but it is something.
Exactly. All right, thank you.
All right, okay, thank you. We'll talk again next week.
Yes, thanks everyone. We
Thank
hope
you
you
very
have
much.
a Connectathon. Thank you.
Take care.
Bye.
Bye.